What's going on, ladies and gentlemen? It's your boy Brad, and I'm back with another video, and I'm coming to you with a nice little special video. This is for all my nursing students out there. The top 10 rules for nursing school clinicals. Let's get into it.
Nurse Bass rocks.
Rule number 1, eat something. Get something in your stomach. They say breakfast is the most important meal of the day. They say it for a reason, and it is especially true for nurses and nursing students, especially nursing students. I've had one or two classmates of mine actually black out, straight up black out, because they didn't get anything in their stomach. And I've heard several other people here on YouTube who are nurses and nursing students talk about the same thing. You got to get something in your stomach, guys, especially for those of you who may be, freshmen, new nursing students. You're going to be seeing some things and experiencing some things that you have never experienced before. So it's good to get some food in you, man. Just trust me, take my word for it. Eat something. Rule number 2, be on time. You like that right there, right? It's your boy Nurse Bass soon to be. Rule number 2, be on time, okay? This is super important, man. And your instructors and everybody's going to stress it to you, but it's professionalism. That's what it is, right? It's the act of being a professional. Whenever you go to clinic, you can basically look at it as you're going to your job, okay? And whenever you get out on the floor on your own in a hospital or wherever, you're expected to be on time, man. Just be on time. It really communicates professionalism to your fellow classmates, to your nursing instructor, and to the staff who are also on the floor. They got to be on time. You should be on time. Rule number 3, be prepared. Come prepared. Again, it's the professionalism. Have everything that you need there for that day of clinic. If you had to do clinic work, bring all your clinic work. Bring your clinic folder. Make sure it's organized, neat. Make sure all your clinic work is together. It's just, again, it's the professionalism. It's just doing what is expected of you. Doing what you're supposed to do when nobody's looking, okay? Be prepared. All right, now that we got the 3 easy ones out of the way, let's get on to rule number 4. Let's start getting into the nitty gritty. Rule number 4, take report on more than just 1 or 2 patients. I know whenever we are in our first couple of semesters, we're only taking on 1 patient. Sometimes we're only taking on 2, as they begin to bump us up a little bit more, but take report on more than just those 2. If your nurse has 4, 5, 6 patients, take report on all of those patients, even if you're only going to do clinic work on 1 or 2 of them. And tell your nurse, hey, look, my name's Brad. I'm a student nurse with this school. I'm here to help you with all of your patients. If you need help with any of the patients, let me know. It's really important to begin doing this because whenever you get advanced up into your senior level, they're going to be hitting you with 3, 4, 5, sometimes a whole patient load. And even more importantly, whenever you graduate, you're going to be doing it, right? So just get in the habit. I think it's really important, and it's a thing that not a lot of nursing programs tell their students to do. They say just take your report on your 1 patient, start doing your research on the meds and labs and all that stuff. Take report on all of them, okay? Just trust me. I think it's fundamental and something that they should be teaching in nursing programs, but just do it, man. You'll be better off for it in the long run. Rule number 5, I decided to throw a couple of my pet peeves in with this mix because it's important. Rule number 5, don't complain. Don't complain, especially about leaving early. We hear it from time to time. Oh, I'm ready to go, man, looking at the watch. But if you're supposed to be there for 12 hours that day, a lot of times you're hardly ever there for the full 12 hours, right? Sometimes you're there for 8 hours, man. Maybe sometimes you're only there for 6, It depends day to day, but don't complain, especially about wanting to leave early, man. The nurses and nurse techs and everybody who are around you, they got to stay there for the full 12 hours, man. And again, more importantly, whenever you graduate and you get on your own, you're going to have to do it anyways, right? So just begin getting used to it and getting in that routine of going in there, clocking in, and staying for the full amount of time. And don't complain, man. Nobody likes that, right? I'm just saying. Rule number 6, begin assuming the role of the nurse. I know that whenever we go into clinic, sometimes we're just nursing students. We kind of just sit back. We observe a lot of things, man. Dive into that chart. Start looking up those meds. Start looking up the lab values from the previous shifts. Look up the notes. Begin organizing your day. Just put your feet in the shoes of the nurse, okay? When you're on that floor, you're not a nursing student, okay? You're a nurse. Begin acting like it. That's all I'm saying. Rule number 7, begin cultivating your time management skills. Very important. Again, another reason why it's good to take report on the full patient load and help your nurse with the full patient load, right? Begin cultivating those time management skills. Look up your meds, look up when they're due, prioritize, right? Which patient should you see first based on acuity or based on the difficulty of the patient, Begin trying to figure out and organizing your day from top to bottom. It's just really important to begin doing this as early as you can in your nursing school career, because practice makes perfect, and the more that you do it, the better prepared you'll be whenever you're on your own and don't have a nurse to rely on. Rule number 8, begin cultivating your bedside manner. This is also really important, man. A lot of people have a desire to help people, but not everybody is a people person. It's important to begin talking to patients, interacting with patients. This was a biggie for me, honestly. Whenever I first started off in nursing school, it was probably my biggest thing. I'm a smart guy. I'm good with pathophysiologies. I'm good with meds and nursing skills, but patient interaction was just weird for me. And I'm a people person. I'm a dude who's outgoing and can strike up a conversation with a stranger on the street, no problem. But whenever I'm a nursing student and I'm doing things for the first time and I am having to assume the role of the healthcare provider, and this person is sick and they're in a foreign environment and somewhere they don't want to be, it's weird, right? It's weird. It's a new experience, like anything. So take the time, I took one day in particular. I said, I'm struggling in this area. I'm deficient in this area. I'm going to devote this day or this morning to developing that skill. And so I really went in, sat down with my patient and just talked to him. I just think it's really critical to begin developing that bedside manner, because it is the foundation of nursing, right? Caring. Rule number 9, another pet peeve. Do not think that CNA work, patient care tech work, is beneath you. Whenever you go in there and you get on that floor, you need to be ready to get your hands dirty. If somebody says, Brad, I want you to help me give this patient a bed bath. Brad, I want you to help me clean this patient up. We need to do a linen change. They got a soiled brief, man. Be like, let's do it. For real. That's the way you need to be. That's the way you need to be, because that is, the job of the nurse, right? Not every nurse, like I just finished a rotation in the CVICU. These nurses don't have nurse techs. They're doing that work. It's part of their job responsibility. And again, it's kind of like, it's the professionalism, like, let's do it. Don't be like, don't be like, I don't want to do that, or I don't feel like I should have to do that. Like, that's silly to me. You need to have it in your mindset. I'm coming here, I'm coming to work. And it really, even though it's not a spoken thing, it communicates a good level of respect to that nurse that you're helping. Like, wow, they're just so willing to help no matter what it is. It's, again, professionalism. And number 10, probably the most important, in my opinion, or one of the most important, seek opportunities to learn, seek opportunities to work. Don't just sit back like a wallflower and wait for the nurse to come to you for work to do. Seek opportunities to do it, man. Even if it's not with the patients that your nurse is taking care of. If you're sitting around twiddling your thumbs and you ain't got nothing to do for whatever reason, go up to other nurses. Hey, do you need help doing something with these patients? I'm here. I want to do something. Put yourself out there. You'll be surprised how much better of a clinical experience you'll have, and how many more experiences that you'll get, right? That's what clinic's for. And that's the unfortunate thing, that clinic is really, most programs, only one day a week, right? And if you only have a 16-week semester, that's only 16 days. And then, of course, the first day's orientation. The last week, you might not even go. You might have a snow day like we did this semester. So you want to take advantage of every opportunity that you have. And again, you're not there for the whole 12 hours, right? So don't complain about it. So, you're getting a very limited amount of exposure in this kind of environment, in the shoes of the nurse. So seek opportunities to work, man. I'm available. I'm here. I want to learn. I'll help you with these patients. Give me something to do. I'm here. Be persistent about it. That's also a subliminal, respectable characteristic to have as a nursing student. So anyways, man, that's all that I got for you guys. I hope that you enjoyed it. I hope that you take these tips to heart, man, for real. Embed them into your very fiber and live them every day that you go to clinic. I hope it helps you whenever you go to clinic, and I hope that you have rewarding clinical experiences. If you haven't already, hit the subscribe button right here, man. I'm putting out these videos every week, motivational content, good tips, educational material as well. It's your boy, Nurse Bass, soon to be, baby. And I'll catch you in the next video. Peace.